Johannes Tesfai is a laboratory technician at Adshimdhun Health Center in Maqala. Johannes, just like his fellow health professionals at the center, was hopeful that the peace deal signed between the Tigrayan and Ethiopian governments would change everything. But he says things are pretty much the same, especially at the laboratory.
During the war, the flow of laboratory equipment and chemicals into Tigray was completely halted. The remaining chemicals were already getting expired, so we were left with nothing. We were unable to give service, especially to HIV-positive and chronic illness patients, as we had no sugar level and viral load measuring equipment. Even now, after the so-called peace deal, we hear so many things like medication is getting into Tigray. Last week, we heard that a convoy of 3 trucks of medication was coming to distribute medication to health centers, but so far, we haven't received anything. Many patients, especially patients with chronic illnesses like diabetics, come here every day, complaining that they can't afford to buy the measuring equipment from private pharmacies, and we send them home, telling them that the medication will get here soon. But we're still waiting for the materials.
On top of the lack of equipment, Johannes and his colleagues have been working in the center without any salary whatsoever. He says the termination of salary for the past 2.5 years is worsening the situation.
Since the outbreak of the war, we work day and night. We haven't stopped, but we are getting nothing. There is no salary. And we health professionals at health centers are overlooked by NGOs when food aid for health workers gets here. We are in desperation. When we submit complaints, we're told to wait a bit more. Now that we've made it this far, despite all this, we continue to work day and night to help our people.
Despite the termination of salary, Johannes says him and his colleagues are determined to help their community. Johannes thinks that more attention needs to be paid for health centers. He says health centers are vital in community health by promoting prevention than treatment, and that health centers need to get proper support from concerned bodies.
Everything needs to go back to how it used to be. Medication and medical equipment need to get here. Our community uses health centers, and most of the time, health center works on promoting prevention than treatment. The federal government also needs to focus on prevention and provide the necessary assistance to health centers.